Fellow Namibians, as you are aware, the world is affected by COVID-19 pandemic. Many parts of the world have seen great infections and many deaths. Namibia has also seen our fair share of infections and consequently a significant number of our people dying as a result of this infection. As we speak today, people are hurting, people are in pain, families are in panic, their loved ones are recovering. Many people are in quarantine centers where they are not well taken care of. Many of our citizens have lost jobs. They have lost their livelihoods. Families are not sure how to start over after the lockdown has been finalized. It's a difficult time. And so therefore today, on behalf of LPM, the collective leadership, and indeed on my own behalf, I wish to give sincere condolences to each and every family member who has lost a loved one due to this pandemic. It is difficult, I know. In some instances, breadwinners have passed on. In other instances, those families that have gone in for operations that are completely not connected to COVID-19 have ended up getting infected. It's difficult. Our hospital capacity and facility is not up to scratch. Our government appears not to have a plan. The only plan they have is one lockdown after another lockdown. You would know that countries such as the United States have given this government at least $100 million Namibian as part of the COVID alleviation response funding. We are not sure how that money was spent. We are not clear whether the testing has been rolled out in all parts of the country. Day after day, the ministry merely keeps on announcing new number of infections. We are told there is a number of recoveries day after day. We are also told that these infections are growing in hotspots such as Wolfish Bay and Windhoek. And therefore, lockdown after lockdown continues to be the clear and perhaps the only policy response of this government. We are in a parallel situation. Our country requires strong leadership, informed by health and medical workers who know what to do, people who are experts, but even them do not, if one has to take newspaper reports seriously, have the necessary protective gear. It's difficult. We are informed that recently a medical health worker is alleged to have infected a patient who went in for an operation. These are the situations that scare many people, and rightly so. But what do we do in a situation like this? One of the things that we as LPM have said before is that you've got to roll out testing much more rapidly so that we know exactly the scale and scope of COVID-19 infections in this country. We've also said that in rolling out these tests, house-to-house testing is the only guarantor of effectively verifying the degree of infections in this country. But that is not being done. Clearly, there is no plan to take this country out of this trouble. We have also said as LPM that there must be a clear path that involves technical and medical advice from technical and medical personnel to advise the ministry as to precisely the types of equipment necessary to effectively help those that are infected to recover from this pandemic. We are not sure whether we have enough ventilators, whether we have enough medical supplies. If you look at the history of this ministry, so much corruption has been at play, so much malpractices have been at play. Supplies of clinical and medical equipment are not on time delivered. There is a challenge in respect of the capacity of human resources to deal with this pandemic. And this adds to the overall shortages that we have in the country in respect of our health workers in regards to other diseases that confront this country. So we've got to stand together We've got to raise our concerns together. We've got to speak out. At a time like this, keeping quiet for the sake of political expediency is not the right thing to do. We have a voice, and we must use that voice. I want to, in particular, also send our solidarity to business people all across this country who have, as a result of this pandemic and subsequent lockdowns, lost millions upon millions of Namibian dollars. Many have written to us, as is the case of the business people in Erongo, complaining about the negative consequences of the lockdown on their businesses. Tourism sector has collapsed. Retail sector has collapsed. They have, in places like Rundu, laid off over 100 workers, and it's just starting. So our country is facing an economic meltdown directly as a consequence of the mishandling of the COVID circumstances. Today, unfortunately, we must also, alongside COVID, raise an additional concern that we have, the auctioning of our fish resources. It is an unprecedented move by this illegitimate government that they have chosen to auction natural resources that are key to the development of this country and to the protection of the interests and future of our young children. The auction appears to be a hogwash, meant to benefit those that have resources, those rich people. We are informed that those that are likely to succeed in obtaining the largest share from this auction are the Spanish. It seems, from what we're told, that the manner in which the auction is being done seems to be indicative of an underhand dealing already set up in January. And now COVID is used as the smokescreen to promote the corrupt activities of this government, yet again using our precious fish resources. Namibians, the time for us to be divided on little, small, petty politics is over. It's our time to look at our country for what it is today. Bankrupt state institutions, lack of transparency, a serious decline in trust of the publicly elected leaders, an inability of the people to speak out precisely because we impose fear on ourselves. It's time to shake off the element of fear. It is time to put on the garment of bravery and to put on patriotism as our shield as we march to correct the wrongs of this government for the past 30 years. If in the coming regional and local authority elections, SWAPO has to prevail for 5 years to manage the regional and local affairs of this country and to manage the affairs of the National Council of this country, if SWAPO therefore survives for another 5 years, Namibia will entirely collapse. Is that what we want? Is it a collapsed economy, a collapsed state infrastructure that we want to wait for before we get to move toward unifying ourselves and standing up against this government? Wherever you are, whoever you are, from whatever region, from whatever age, from whatever generation, from whatever social standing you come, let's join hands to look ourselves as citizens of one country with a shared destiny and to say to each other, let us stand together to defeat a government that does not work for us. Certainly, once by Monday they complete the auction of the fish resources, they will not be able to tell us transparently how much was made. And indeed, judging from their past record, it is all but certain that those monies taken from the fish resources through this auction will not go to address the COVID-19 pandemic. But I want to make this point very clear to us all. It would have been good if the housing crisis was also one in which this government would have used fish resources to benefit our people. It would have been good if the student financial crisis could have been one that urged this government to use fish resources to strengthen the student financial scheme. It would have been good that in the instance of health infrastructure, in the instance of massive hunger, in the instance of numerous young people unable to find jobs, that these resources could have been used to finance sustainable long-term programs and projects that would directly benefit our people. And so as LPM, we have said that the looting has not started 5 years ago. The looting has been ongoing for many years. We are merely seeing the masterful execution of the looting that has been accumulated over the past 30 years. We are worried, and so should you be, about the future of this country. That while the Chinese are in fact the owners of most of the mining companies in this country, that the fishing resources is now the new terrain of play by the elite. This money that they will gain from this auction, yet again, will go to private pockets. What do we say about it? Of course, we know the lockdown has also strategically been calculated to prohibit Namibians from standing up in gross protest of the rejection of this government. They have had judgments during this COVID period. They have put severe lockdowns on our people. In fact, many people are infected in quarantine centers. Their health is put at risk. But the lockdown has also, of course, therefore been a political instrument to silence us. Wherever you are, reach out to LPM, talk to us, stand with us, so that we know and recognize that while there is a genuine health issue as it relates to COVID, that there is also a political conspiracy to keep us locked in and locked down so that we do not speak up and speak out against the wrongs that these people are committing against our country. The leaders that we have today in government belong in prison. They are violating every inch of the constitution of this country. They are using laws that they have passed to benefit themselves, to legitimize an incalculably harmful approach to our natural resources, the fishing resources. You remember that they wanted to start mining precisely where the eggs of the fish were laid some years back. That was blocked. Now COVID is being used both to militarize and politicize society around the issues that they have long planned to execute. Prohibiting people from demonstrating when they have lawsuits against their lawyers, prohibiting people from speaking up on how their families are buried, and generally imposing on our people a sense of fear and a deep-seated silence that if you speak, the military will be unleashed upon you. So we have many things to discuss, but for today, I just thought that we needed to say a few things about the fishing auction and COVID. There is a way to deal with COVID. Other countries have done well. Others are not doing so well. But recently, for instance, the World Health Organization has approved saliva testing. Where is Namibia in respect of that? The ministry does not share with us concrete plans on how they intend to reduce and eliminate COVID infections. Are we left to nature? Those that are not fit to die? Those that recover, perhaps by some stroke of luck to recover? Where is the medication to deal with some of these things? Because there is some treatment that can be had for certain types of individuals who are affected by COVID. Are the numbers really trustworthy? When do they extend the testing to all over this republic? These are some of the questions we have. And you, I'm sure, have more questions. The test results have also shown inconsistencies. Some of the results were fake. Some of them seem to have been manufactured. Some of the way in which the tests were done are far from reliable. So we have things that we must talk about. But above all, we have a country to stand up for and a future to defend.